time. And I've been working on a bipartisan basis for about 5 years now to get a health information electronic medical record system in place. I do not think we can afford to wait much longer. I'm very hopeful. Senator Kennedy and I have spoken about this in the last week or two. I'm very hopeful that we can try by the end of this legislative session, around the end of September, to pass this bipartisan legislation. Like so much else about health care, it is not perfect. But we have let the perfect be the enemy of the good for too long. We need to get a system in place, see it operate, make the changes and adjustments that are necessary, because every one of us can come up with a problem or a concern about chronic care management, about electronic medical record keeping, about best practices and evidence-based medicine, about malpractice reform. We can all come up with an objection. And that's one of the reasons we don't get anything done. Because the folks on the other side who are making lots of money off of the health insurance industry and all the other aspects of the healthcare system are perfectly happy to let this dysfunctional system just keep going. So we've got to make up our minds. Are we going to have the changes that may not be everything we want, or are we going to say, until it's exactly what we all can agree on, or my way or no way, we don't do it? So I hope that we can take that attitude as well into these negotiations and into this effort to build consensus. When we come forward with a Democratic plan, and we have a Democratic majority that's even bigger in the House, and we have a much bigger Democratic majority in the Senate, getting closer to that magic number of 60, and we have a Democratic president, we have to have all of you outside of the legislative process pushing as hard as you can to make it happen. And I was delighted to see that Harry and Louise have come to their senses and understand that we've got to make progress together. There is no way that we can just let our system continue to bankrupt our country, our businesses, our families, be so morally indefensible as it is today. As I said last night, I am looking forward to being there when President Obama signs the bill that will come to his desk for quality, affordable health care for every American. And when that happens, I imagine many of you will be there too. We will have to probably duplicate what will happen tomorrow at Invesco Field. We'll have a bill signing, I don't know, at the Redskins Stadium or the new baseball stadium in Washington, because this will be the kind of transformational change that comes once in a generation. I'm ready for it now. I think all of us are. So first things first. Let's elect Barack Obama and Joe Biden, and then let's go make health care for all a reality.